So we're here with Abby. Abby, thank you for being our model. And Abby's actually been wanting to get a halo for a little while now, so this works out perfect. But she has great skin to do a halo. She has great skin, but she has some sun damage. She has a little brown freckling here, some fine lines. I think she might want to improve her pore size or appearance of her pores. So just a general anti-aging treatment is what she's going for. She doesn't have any major issues, as you can see. So she's one that would get kind of a light to moderate treatment of halo. And she's going to find that over the next few months that she's going to see improvements in all those. And one of the things my patients tell me, and you'll see even in their marketing, is that we call this the halo glow. And people just say, you know, I just feel like my skin is glowing. And I felt the same way when I had it done. So we're going to begin treating Abby, and she hasn't taken any form of pain relievers or anything like that, just had the little topical numbing. And so we're going to start with the laser. We're going to do this cheek, forehead, and nose. The whole procedure takes 15 to 20 minutes. So as you can see, we're just rolling this across the skin. It's making these little tiny white dots on the skin. That's where the laser is doing all of its work. You see the white dots. There are some other dots that you can't see where the laser is going a little bit deeper, and that is getting down closer to the collagen. So the white dots that you can see are helping resurface actually the surface of the skin and helping with pigment. And those little microscopic dots that you're not seeing are down there doing a lot of work underneath the skin. Okay, roll your lips together, Abby. So we're going to go across the upper lip. Abby's being really, really good because I don't even think she had topical numbing done. So she's being really, really brave right now. But we also like to get the lip, upper and lower lip, those lines right around the lip. So one of the things that this treatment does is allows us to really get everything on the face that bothers people. So I talked earlier about how this is a smart laser. So we've measured Abby's face. Then I've put in the energies that I think Abby needs to get good results. And I'm just going to laser her face until the laser beeps at me and tells me that Abby has had the perfect amount of treatment. So it's not up to my judgment at this point, it's up to hers. Because it depends on skin temperature, which it's constantly measuring, which I think is really cool. It also is a safety feature, but it also makes sure we're giving her a really good treatment and that she's going to get great results. So we're just going to keep on going back and forth over her cheek until the laser, like I said, tells me that it's time to move on to the other cheek. We are blowing a cold air on Abby's face, and we do for everyone, and that helps with the pain level. So it's blowing on the face through here as we laser the skin. So you see, as we're done with the side, you can see how there are thousands of little laser dots on the skin. So that's thousands of little micro injuries that have been created that are going to stimulate healing, which brings in new collagen and all kind of other wonderful things. So that's what the little white dots are. They'll actually turn brown in a few days. That tells us we're done with this side, so turn this way. They're actually going to turn brown in a few days and then lift off the skin and fall off, and that's the part that's so wonderful. A lot of people ask me questions like, how many halos do you need, how far apart, what time of year? So I typically tell people one halo does a lot, but it is best to do as a series. As you do more and more, about I'd say a month to 6 weeks apart, you just get more and more results. So like I said, a lot of people are happy with one, but if you have deeper lines or acne scars, we're typically going to recommend to do 2 or 3. Some people do even up to 4. Other people will say kind of this is going to be my yearly cleanup, and so they do 1 a year, and that's going to be what I'm going to do. I did great with 1 halo as a cleanup, and so each winter I'm going to do a halo to kind of clean up the damage that got caused over the summer just here living in the South. The other thing is time of year. This can be done any time of year and really on any skin tone, any skin type. Obviously we adjust our settings accordingly. Turn this way for me, Abby, just a little bit. But we really want you not to be actively tan or sunburned or have had a lot of sun exposure in the weeks leading up to the procedure, because it could cause us to have to turn the laser down a little bit to not cause problems, or if you have an active tan, it could cause some problems with hyperpigmentation. So fall and winter is definitely the best time, but if you're really good about sun protection, this really can be done all year long. We're actually going to take this cold air that we have that was attached to the machine, and we're going to give it to Abby, and she's going to now be able to blow the cold air on her face, which is going to be wonderful because right when you're finished with the halo, it's a real intense sunburn feeling. Sometimes even for a few hours. Some of our patients need to take maybe Advil or something like that. And some people say that's the most uncomfortable part, is the several hours after the procedure. Most patients, I mean, rare if ever do I hear anyone has any discomfort in the days that they're healing. They're just doing some wound care. That we will include all that with the procedure cost. We'll give you everything you need to take care of your skin. But most people don't want to leave this little cold blowing device behind. So I think Abby's probably really enjoying that. And we'll put a little cooling mask on her and give her instructions, and she'll be good to go in just a few days.